talk about blood pressure medications. And I'm going to make this fast and talk really fast because there's a lot of information. So a lot of doctors just prescribe blood pressure medications and they pick one and they run with it. And there's not anything necessarily wrong with that. And just so you know, a lot of times it takes doctors, including cardiologists, a few trial and errors to figure out what medication is going to work best for you. So don't get upset at your doctor if you have to go back multiple times trying to figure out which medication is going to work. However, the first medication we choose is kind of important. Number one, how high is your blood pressure? It's very high. It might require 1 to 2 medications, maybe even 3 right off the bat. Number 2 is what other underlying medical problems you have. So for instance, if you have diabetes also, then we should choose ACE inhibitors or ARBs to start with because they also help to protect the kidneys from the detrimental effects of the diabetes. Now, the other questions that a lot of doctors might not ask about is if someone's anxious or depressed. If someone's a very anxious person and they're self-proclaimed anxious, beta blockers might work really well on these people because they help to kind of calm that anxiety as well. On the flip side, if someone's very depressed, beta blockers are not usually a great idea in these patients because it can worsen the symptoms of the depression unless there's some other reason that the patient must be on a beta blocker, if they have heart failure, if they've had a heart attack, and things like that. And then there's other classes of medications that we can kind of dabble in as well that can just really help the blood pressure and really are kind of neutral when it comes to side effect profiles. So always ask your doctor kind of why they're giving you those medications because a lot of times there's other reasons as to why we do it.